Well, from the NFL to even down to Pop Warner leagues, there is an effort underway to develop better treatment and prevention methods for concussions. Now, on the Sun Coast, there is a clinical trial underway to help treat that type of brain injury. ABC 7's Alex Redman is here with more. Alex.
Thanks, Haley. A nationwide study of a new therapy helps football players suffering traumatic brain injury following a concussion. High-performance NeuroFeedback is now being used to treat military personnel and others right here on the Sun Coast.
Now we're hearing that it is a concussion.
We all know football is a contact sport, and sometimes that contact leads to concussions.
Some were major, some were minor. According to certain doctors, anytime you have a blow to the head, it's considered a concussion.
Former NFL linebacker Joe Odom of the Chicago Bears and Buffalo Bills has had his share of concussions.
The issues that follow that, and then combined with the brain injuries and everything.
Now Odom and Kenny Green, formerly of the St. Louis Cardinals and San Diego Chargers, are taking part in a nationwide study of high-performance neurofeedback, HPN.
There's a huge population of guys that have had injury, brain trauma, that are dealing with the consequences.
Military personnel suffering PTSD and others with traumatic brain injury also benefit from HPN, says co-investigator of the research project, Dr. George Rizal.
The hope is that we can get the brain unstuck.
Sarah Merrifield's brain injury is the result of a 20-foot drop.
I fell off a balcony.
This is what she remembers.
2 months later, waking up out of the coma.
Then came symptoms.
I was having trouble with issues in my life, I was like stuck.
But symptoms of TBI can vary.
The brain is irritated, people have fatigue, they can't think straight, and they get depressed. So this changes all of that.
HPN tracks brainwaves, or EEG, then sends back signals to change patterns so that they are more highly functioning.
It helped me relax, it helped me sleep better, it helped me not think too much about any certain thing.
Odom is hopeful this technology will help others as it has him.
The only thing that's really consistently and immediately relieved a lot of the issues.
Dr. Rizal says up until now we've been very limited in terms of what we can do with post-concussive injuries with traumatic brain injury. And this kind of neurofeedback system can be applied to all forms of head injury, from kids playing youth sports to pro athletes and veterans suffering from blast injuries.
And so how long does it take for this therapy to work?
You know, for everybody, it's different. Some people go in there and they said that it can take a minute, 5 minutes the first session. For others, a couple of sessions. But the good thing is the sessions are very short, only a few minutes, and up to about 20, and they're cumulative. It gets better every single time. So it's very hopeful.
Okay, thank you, Alex.